COVID-19 continues to expose the gaps in our public health system. Overcrowding is a death trap for the poor seeking help in public hospitals. Many are actually dying in the corridors. This as South Africa faces a possible second wave of COVID-19. Of course, it must be a nightmare for healthcare workers who are already crying foul over understaffing. Our reporters are all over the story. Senior reporter Aviwe Mtila is in the Eastern Cape. There's Ntathia in KwaZulu-Natal, as well as Monique Mortlock in Cape Town. So, Aviwe, let's start with you. Of course, the situation is pretty dire where you are. People are dying before they even get treatment. Tell us what you found.
Certainly not a pretty sight, Shahan, as we went in exclusively inside the hospital of Nelson Mandela Bay. Now, government says that it's done all it can, but those efforts are falling flat because of the behavior of the residents who aren't adhering to COVID-19 regulations. Now, inside the hospitals, you'll find that the casualty wards are full to capacity, and you'd understand that public hospital can't turn patients away. So those patients, an influx would find them basically in the corridors. Now, the mortality rate is what's really concerning, finding out that half of the patients in those casualty wards don't make it out alive. And in fact, 80% of patients in the ventilators also do not make it out alive. Now, this, of course, has prompted another visit from the health minister within the space of 2 weeks, expected down in the Eastern Cape sometime this week, but this time with reinforcements from the social development minister, Lindiwe Zulu, as well as the COGTA minister, Dr. Nkosazana Dlamini Zuma, basically joining the MEC of Health in the province to deal with this resurgence of COVID-19. But I want you to listen in on the acting CEO of Livingstone Hospital detailing how the mortality rate has been impacted in Nelson Mandela Bay.
80% of the people who go to ventilation in ICUs, we lose them. We lose half of the people who come to our wards.
One of the examples, we had a lady, we had no beds or stretchers available. She passed away in a wheelchair, sitting in amongst a crowd of people in the respiratory area. There was a 13-year-old boy lying in the bed next to her, and another lady lying in another bed right next to her, also watching it as it happened.
So let's talk about healthcare workers. What else they're telling you, Aviwe?
Sean, just last week, as Minister Zweli Mkhize visited Port Elizabeth, the hospitals there, they were actually protesting outside Livingstone Hospital, saying that they want to be heard. You'd understand these are frontline workers, saying that they're dying in numbers. Now, in our exclusive look inside the various hospitals, we spoke to a number of doctors detailing basically how a lot of nurses and doctors and healthcare workers are getting infected in the front line. But that's not the only cause of concern. Fatigue is another issue, with a lot of patients passing away. This, of course, comes as a shock to the junior healthcare workers. Let's listen in on some of the doctors and what they had to say on that.
I saw a message now in our work group. I think the whole nursing team in neonatal ICU has tested positive. So that's an entire nursing team in an ICU that has to now be quarantined for 10 days.
It's extremely difficult for staff to stay in PPE and also to keep motivated. There's a very high burden of patients who are passing away and who are suffering. And it's very difficult for some of our junior staff to carry that and to carry that burden. So we actually need fresh legs.
All right, let's move to KwaZulu-Natal. Yes, and you're outside the Addington Hospital. What's the state of that facility?
Well, let me start with this, Shahan. When we were here this morning, there were long queues that were running along this pavement that I'm standing on now. And many of those people had gathered here from well before 6 a.m. hoping to get in. Now, Addington Hospital has always been a busy facility. COVID-19 has just made that a little bit worse. I was just engaging with a patient now who unfortunately didn't want to speak to us on camera, but she's just standing not far from me now. And she was telling me that she had gotten here at about 5 a.m. this morning, and it's just now that she's actually wrapping up and finishing and waiting to go home, and that was just for a regular checkup. Now, many people that come to this facility have similar stories of how long they've had to wait to get in, but it seems that when they do get inside, it's not much better, because then they're dealing with the issues around the actual condition of the building. It looks fairly pretty on the outside. That's thanks to a revamp that was done not long ago. But on the inside, it's a completely different story. If you go down into the basement, you'll find that there are areas of that's flooded. There are other issues around parts of the roof being broken. And just recently, there was a protest that was held here by some of the unions. The Public Servants Association was among them. That was relating to the issue of lifts. Of the 10 lifts that are here, 2 of them are functional. Now you can imagine what a problem that's caused for both patients as well as the staff that have to go up and down the many floors of the Addington Hospital. I just wanted to listen in quickly to Mlungisi and Ndlovu. I spoke to him earlier today about the conditions under which their members are working in this hospital.
One of the biggest challenges here is the issues of lift. These challenges has been there for years and years and years. There have been some discussions with the head office in terms of trying to fix their lift. Seemingly it is not working. So it is for these reasons that we believe as PSA that the department should be open to us, because it's very clear they can't fix the lift. And now we have heard that they've redirected the patients. They are starting to discharge the patients that are stable. And you must remember that this hospital has been in existence for more than 100 years. So it can't fail now. It is for this particular reason to say the staff are frustrated. They've been working under these conditions.
All right, let's move to the Western Cape. And Monique, you're at the District 6 clinic. Tell us whether healthcare workers are actually ready or feeling the pressure as we face the second wave.
Shahan, I've spoken to healthcare workers, not at this particular clinic, but at different health facilities, hospitals and clinics in other parts of the Western Cape, from doctors to nurses to allied health professionals like your dietitians and your physiotherapists. And they all say that they are overworked, overburdened. They say that with a second wave approaching in parts of the Western Cape, it's already approached, like in the Garden Route, the George and Knysna hospitals are already bearing that burden. The physicians and the nurses have told me that they are concerned about how long they'll be able to continue working the way they are working, especially with the busy festive season approaching. In fact, one medical officer told me she and many others like her have been dealing with mental illnesses, and this is what she had to say.
A lot of us are suffering from mental illness, depression, bipolar, panic disorders, obviously anxiety as well, because it is a very stressful situation to work under. A lot of us are on medication. Because we are struggling to cope with the work demands.
So, Monique, of course, this is not just about healthcare workers being left to fend for themselves. How's the health department in that province planning on assisting them?
Firstly, when I asked the National Health Department about this, I asked them what is the reason for this understaffing, because it's not only a problem in the Western Cape but in other regions as well, like in the Eastern Cape and KwaZulu-Natal. The National Health Department says they are aware that staff in hospitals are overburdened, that they are overworked, and a large contributor of this is that there are vacant posts, vacant funded posts open, and this is due to budget cuts implemented by National Treasury. The National Health Department says that it's looking at introducing new services to help alleviate the burden of nurses, of doctors in hospitals. But here in the Western Cape, the Health Department has said that they have a human resources battle plan in place. This is what Dr. Sadiq Karim had to tell us this morning. He's the Health Department COO.
During COVID, we brought additional staff in. We had a number of volunteers, people who just volunteered their time to work in our public facilities. We had private GPs that were able to come and help us in our hospitals. So yes, I think the staff are obviously overworked. I think one of the big concerns as we move forward into the festive season is in actual fact that given the violence, the expected violence and trauma that normally increases this time of the year, particularly given that alcohol is more freely available, we are obviously concerned that that's going to place an additional burden on our staff whilst they're having to treat our COVID caseload as well. And we also have additional support programs in place for our staff who are feeling a bit overburdened and fatigued. We had, after the first surge, encouraged some of our staff, those who could, to take leave so that they can actually refresh themselves and reinvigorate themselves. But even I was told to take some leave so that I could reinvigorate myself. So we have a battle plan for our human resources, but obviously having said that, our concern remains the festive season and the increase in trauma and caseload that will place an additional burden on our already hard-working staff.
All right, let's bring Manqoba Mqunu into the conversation. You, of course, have been monitoring things in Gauteng. The one thing you're hearing is understaffing being an issue.
Certainly, Shahan, and that's a major headache for most healthcare workers here in the province who say they simply cannot cope with the number of patients that they receive on a daily basis. We spoke to some nurses who say that the staff or the nurse-to-patient ratio here in Gauteng is about 4 nurses to 45 patients, and they say this is simply a headache for them, a daily nightmare, given the fact that they cannot cater for all of those people that are there. This means that they are unable to provide the efficient care to some of those critical patients that need that care the most. So many of them are saying that they're quite frustrated, Sean, they're quite stressed, and they're very desperate to see some sort of intervention from government, who they say has turned a blind eye on the fraternity. And of course, another issue, a big issue that they say is quite a huge concern, is the lack of resources in many of these hospitals. We do know that some of the X-ray machines, for example, the BP machines are broken and they do not get fixed by the department. The hospitals and the nurses are saying that there's simply no money at times to fix some of this equipment. So they're saying this actually makes matters worse when it comes to trying to save lives. And they say that actually they believe that some of these deaths, the premature deaths that is, happen because of issues around the resources and the equipment in these hospitals. Let's take a listen to what one of those healthcare workers had to say.
Can't wake up every day with the aim of going to the hospital and kill people. But you go there knowing that someone is going to die, and that particular somebody we were going to help. If we can at least notice while it's still early that this person's condition, this patient's condition is changing. Sometimes it's too late. You see it while it's too late. Even when you because we don't have equipment, resources. Even now, resources, not only the apparatus that we are using in the ward. Sometimes you have a patient in your ward, in your general ward. You need to take that particular patient to high ICU or high care so that they can have a closer monitoring by a nurse in high care or ICU. You can't because the ICU is full. High care is full as well. It's crazy. Sometimes we donate, we contribute our own money so that we can go and buy that particular apparatus, because we understand that we are not here. We can't be killing people every day.
So, Manqoba, of course, we have some healthcare workers telling you they are afraid to speak about the problems because they might be victimized. What's the Gauteng Health MEC saying about that?
Indeed, Shahan, in fact, we did speak to some of those healthcare workers, some of whom refused to even speak on camera, saying that they fear being victimized and also that they might actually face charges by some of the hospital management. In fact, we had even arranged some interviews with several of those healthcare workers, but at last minute they turned us down, saying that they even fear the fact that they might also, the bosses might also make them out just by what they are saying, because usually they're the people that raise issues in their hospital. So there's definitely a sense of fear and a sense of many of these healthcare workers wanting to come out but feeling muzzled by their employers or the system, because they're saying that if at all they do speak, they are then intimidated by people. We did speak to the health MEC here in Gauteng, Jacob Mamabulo, about this, and he says that workers should in fact come out. He has encouraged them to speak out, saying that they can even contact his office if they want to raise some of these grievances. Let's take a listen, Shahan, to what Jacob Mamabulo had to say on this issue.
I would like to encourage them and actually assure them that they should feel free to raise any matter without fear, favor, or prejudice. To that extent, I can advise them that We do have good relationship with organized labor. We talk to them, we engage our workers. In this province, we have actually demonstrated over time the good working relationships with trade unions, and workers should feel very free to approach their trade unions where they might feel that they are not comfortable to raise a matter. Our phones are there for the public, and we are contactable. The government, the whole of government, has set up platforms and structures where people can go raise issues without their identity being exposed or put at risk.
All right, we can leave it right there. Mangoba Mkunu, Monique Mortlock, Desantathia, and Aviwe Mtila. Still